I'm sitting down with P.G. Forrest, who is the director of the Institute for Health and Social Policy at Johns Hopkins School of Public Health. And today, tell me about the role you see the Institute for Health and Social Policy playing in the harm reduction meeting.
The Institute has been established originally to look at questions that are at the cusp of major health and social issues. So this is clearly major social issue. And so I was very glad when Dan Moraim and Beth McGinty, who are both associated with the Institute as faculty, came to see me and asked me if we will be interested in hosting a major symposium on harm reduction. I thought it was clearly within the mandate and mission of the Institute, and the rest will be history.
So, you are coming to us from Canada, a nation that has been somewhat more willing than the U.S. to adopt harm reduction approaches to the problem of addiction. Are there policy lessons that we can learn from our Canadian neighbors on this topic?
Well, this is a complex question in a way, because it's true that 10 years ago, Canada, we were among the first nations to go the way for medical marijuana, for instance, and creating a national framework for medical marijuana. Canada, as you know as well, was the place of the first North American experiment with a safe injection site, a project called Insight in the downtown east side of Vancouver, resulting from a major public health crisis at the end of the 1990s. And this experiment is still there. It has been validated by a spectacular decision of the Supreme Court of Canada in 2011. It has produced results that have been published everywhere, and therefore could be replicated very easily if someone was interested in learning a little more about how this has been made possible. The next step for Canada will be, well, twofold. We have a new government that has clearly significant its intent to legalize marijuana, not only decriminalize, but legalize marijuana. It will be, there again, a very interesting experiment, given the U.S. official position and the fact that we have a very long common border. And the second thing is that following the Supreme Court decision in 2011, some guidelines have been put in place for the creation of more safe injection sites, and we should see them appearing now in major Canadian cities, which will give us a sense of how this experiment could be replicated.
Okay. You know, in the United States, obviously, addiction and drug policy issues are very controversial. How do we ensure that the dialogue about these issues is informed by research evidence?
Yeah. Two ways of addressing this question. The first is something that we know from the literature on the influence of research on policy. And we happen to know, and we have verified that many times, that on average, after 10 to 20 years, the actual number is 15 years, ideas that have been well supported by a wide consensus of academic research tend to make their way into policy. So there is in a way, the fact that we have this discussion today, that so many people are in fact agreeing about the major objective of harm reduction, will produce in the long term results. And what we are seeing already in the U.S., for instance, in terms of the decriminalization of marijuana, is clearly the result of that kind of effect. The other way is more active intervention of research within the solution of public policy problems. And if I go back to my example with Insight, a phenomenon that has been underlined by the Supreme Court is that Insight is itself the result of the collaboration between three different constituencies: the academic community, provided first-rate support in terms of research instruments for the project. The community itself, that was facing a huge public health and safety, personal safety problem, and decided to engage itself in a project like this, and intergovernmental collaboration. And I think this is a recipe for success that could be replicated here.
So thinking about that, those three constituencies working together, do you think there's a role for the Institute of Health and Social Policy here at Johns Hopkins and in Maryland to be a leader for that sort of work on the East Coast here in the United States.
Oh, absolutely, and probably, and I hope even with a sort of national reach as well. But it's clear that one of the things that the Institute tries to do is create a safe platform where people coming from the academic world, from the community, but also from different levels of government could actually meet and talk and discuss and confront their ideas. And I think this is what we will do in the future.
And one last question. Do you think that in the confrontation of ideas between the different levels of government and academics and the sort of social services that we see today in the harm reduction meeting, there's a possibility of seeing more collaboratively generated legislation at the federal level, not just at the state level?
Oh, I think it's indispensable. As I mentioned, when we talk about intergovernmental collaboration, it's clear that this is a problem that is very difficult to resolve at a very local level. It needs to involve state and federal legislators as well.
Fantastic. Thank you very much, Vijay.
It's been a real pleasure. Thank you.